Hello, friends. Back again to discuss something about giddiness. Giddiness is a very common symptom. How many of us have heard this? Doctor, the whole world is spinning. Suddenly, I don't know what to do. It's very scary. I don't know where to put my foot. It's really scary. I don't know what to do. So I came running to meet you. This is a very common scenario. This is called vertigo. So, in vertigo, there are a couple of things we should know. The most important thing, as I said, is the feeling of the whole world revolving. This usually starts suddenly. It is usually lasts for a brief duration, for a few seconds, and it is usually accompanied by change of posture. This is what is commonly meant by vertigo. This is reported by patients at giddiness. This is a very common and a very eminently treatable condition, and one has nothing to worry about it. However, it is extremely scary because the patient doesn't know where he or she is. He doesn't know whether the earth is down, the sky is up, or the sky is down, the earth is up. The whole thing is revolving. It's really scary. But the good thing is, this generally doesn't last for more than a few seconds. However, if it lasts for a longer duration, and most often if it is accompanied by something else, for example, a patient says that he sees double during the episode, or he is not able to speak properly, or he is not able to walk properly, or his face twists to one side, then there is something more to worry about it. So again, we are back to history. So sometimes stroke can mimic like vertigo. Otherwise, vertigo is mostly due to a problem of the balance in the inner ear. Most often, there are a few small bones inside the ear. The position gets dislodged due to some reason, and due to manual repositioning, which is usually done by either the ENT doctor or the neurologist, the patient gets instantaneous and lasting relief. This is what is commonly known as vertigo. Okay. Yet another scenario. Another patient says, Doctor, I have giddiness. So when you ask, what do you mean by giddiness? Doctor, I felt giddy. Everything became dark and I started sweating and I passed out. Now this also is interpreted as giddiness. So what do we know from these things? Giddiness is a very loose term which is used by the common people for many conditions. So right now we have seen two conditions which can be reported as giddiness. The first is vertigo and the second is what we call as transient loss of consciousness, or what is commonly known as passing out. Here this is called syncopal attack. There is a transient reduction of the blood supply to the brain because the BP drops, and the patient classically says that I know I'm going to fall. Everything becomes dark. I start sweating, and before I could hold on to something, I fall down. But within a matter of seconds, I get up. Again, this is a condition which predominantly involves the heart, and so it is important to get the heart checked. Most often, this is a benign condition, meaning thereby nothing much to worry. So you would have heard, and you would have heard or seen in films also. There's a shocking news, and suddenly the heroine collapses, and the hero comes to save her. Okay, so because the heroine listens to some bad news that her parents, something happened to her parents, and she collapses. This is called vasovagal attack in response to a sudden severe emotional stress. Or some people, when they go to the hospital, they faint. In fact, I also fainted initially. Okay, so this is all because the fear of blood or the fear of something, or any fearful episodes can present this. Again, this is nothing to worry, but it's extremely important to remember the first aid. All one has to do is the moment he or she knows that something is going to happen, he has to lie down flat and, if possible, lift the legs. Wherever he or she has to do this. This is another important first aid the public has to remember. Most often, what is done is when the person feels giddy, he starts sweating, they make him sit in the chair, they tap his chest, they give him water to drink. That is the wrong thing to do. Immediately, he or she has to be made lying down on the floor, and if possible, elevate the foot. Within a matter of seconds, they'll be all right. Okay. Now, this is the second condition which is interpreted as giddiness. Okay. Yet another patient comes. Doctor, I am feeling giddy. So on questioning, the the patient says that during these moments of giddiness, which last for a few minutes, I am not able to walk. I feel that my right side is not okay, and my speech is slurred, and sometimes my face also twists to one side, which is there for a few minutes and it becomes all right. This is again a very, very important warning symptom. This is called transient ischemic attack, which again is misinterpreted by the patient as giddiness. So, giddiness should not be taken lightly. We have to go into the details. Transient ischemic attack is very important because if we catch patients at this stage, almost always it is possible to prevent them from going into a major stroke. As you all know, stroke is a very deadly and devastating disease which not only affects the patient but the entire family is affected because she is totally bedridden and he or she is dependent on them for all activities of daily living. Okay, so we have seen three scenarios. Now, what is the fourth scenario? Doctor, I am feeling giddy. Again, on asking, he says, Doctor, I was sitting. I don't know what happened. After a few minutes, I find myself in a totally different place. On inquiry, this has happened to me on a few times. On inquiry, I was told that I had some jerky movements of my hands, and once I bit my tongue, and then after a few minutes, I woke up in a hospital nearby. I don't remember how I went there, who took me, and I got up. I was extremely tired, as though somebody had hit me all over the place. This is yet another symptom which is being misinterpreted as giddiness. Okay, so here the problem is actually it is called convulsion or a seizure disorder, which again is misinterpreted. Here again, I would like to tell some first aid. The first aid in a patient who developed convulsion is very simple. He or she has to be made to lie down on the floor, and he should be, suppose the patient is like this, he should be made to lie down on one side, either left or right. The idea is the saliva all comes out, and please don't put anything in the mouth. That's a very dangerous thing to do because anybody, when he or she is unconscious, if something is put in the mouth, it can go to the lungs. Okay, not to hold hands or feet, never give a key, don't put the finger, and it will settle down automatically. Okay, and this is another thing which is interpreted as giddiness. Then the fifth one is the doctor, I am feeling giddy for a few days. On inquiry, he says that I am not able to walk in a straight line. It is as though I am totally drunk. So this is again the problem in the back region, posterior portion of the head, which is called cerebellum. If there is any problem there, it results in unsteadiness of a gait. So from morning to evening, it appears as though he or she is drunk. Many times, the relatives mistake such patients to have to be under the influence of alcohol, but actually it is something which has happened behind. So a few more words about true vertigo. So vertigo is because the first one I am talking about. It is because of imbalance due to the alteration in the position of the small bones of the ear. In that, there are a few types. One is the commonest thing which I said is due to change in position. The other thing is sometimes due to viral infection where it lasts for a few days and subsides. Then there are a few more conditions involving the ear which can present like this. The most important thing is they will have extreme vertigo, that means the feeling of whole world revolving or they are revolving, but they will not have any other symptoms. For example, their speech will be normal, their vision will be normal, their memory will be normal, they won't have headache. Of course, they may have vomiting, but no other symptoms. Some difficulty in walking because they will not know where to keep the foot. This is generally tackled by the ENT or the neurologist. It's a very, very benign disorder. It can be eminently treatable. So, to summarize, today I told you something about giddiness. The point I want to drive home is giddiness is a very broad term which encompasses many diseases. So, just a feeling of giddy should not be taken lightly. It has to be qualified further. So, there are generally 4 or 5 causes. One is true vertigo, which can cause giddiness, a feeling of spinning. Second is loss of consciousness. It is called epilepsy. That can be mistaken as giddiness. Third is syncopal attack or vasovagal attack, when suddenly the blood pressure to the brain reduces. This is also interpreted as giddiness. And the fourth one is stroke, when there is reduced blood supply to one portion of the brain. In addition to feeling giddy, unsteady in walking, they may have some difficulty in speaking, walking, with or without associated vertigo. And the fifth one is pure unsteadiness, which can be misinterpreted as benign giddiness. So, these were a few points about giddiness. I hope it was useful. Thank you.